Hi, I'm Jacque Smillie of BanishingFear.com. I've been in alternative healthcare for 34 years, and what's most important for me right now in Banishing Fear is to bring the tools that I've used so effectively into the hands of people in the medical profession. While medicine does great things and has never done better things than it does right now, there are still some gaps, and this is no time like the present to bring the alternative with the cutting edge, exciting medicine, bring it all together. One of the techniques that I teach and that I'm certified to teach is thought field therapy. And that's what I have this wonderful panel here tonight, is to talk about how they are integrating this incredibly powerful technique into their medical field. Tonight I have with me cardiac rehab nurse Michelle Bruni and Dr. Sherry Ziprick, who is a biological dentist. I don't know if it's okay to say she's also my dentist, but she is, and Masters of Physical Therapy Ken Pintus. So thank you all for being here, and we'll just get started right away. I want to know what brought you to thought field therapy?
Well, I'll just start up. I'm a physical therapist for the last 16 years, 12 of which have been in the home health setting. And I know Michelle from the very start of my career and have been kept in communication. And TFT flyer showed up in home health, and everybody else kind of pushed it away and kind of said it wasn't worth anything. And I know Michelle, and we go way back, and it was a class of Jacque, yourself, and Michelle Todd, and I just could get on one of those things where I'm getting too old for my job now and some of the stuff that I do, and I need to be less of a physical portion and more into trying to help the other part as well, cognition and mentation of these patients at home. So with that tool that I learned from you two, it's just made a huge, almost shotgun approach at resolving a lot of cognitive issues that hold me from reaching my goal of keeping safe at home and at home. So that's how I use TFT, is to render down and bring a person to come to grips with things and just make their lives more special. So thanks to you guys, I can do that now, where I can't just give them an exercise program and move them on, that I can actually resolve some issues that give them some peace in their life and then fix them up physically to progress to be better humans now. So that's how I use it.
That's excellent.
I came to this because I knew Jacque. I went to see, it's probably been 15 years ago now, and she helped me just amazingly. I had severe allergies all my life. I don't have any allergies now, and I was very open to alternatives, having grown up in a house where my mom, following a heart attack in her 30s, became addicted to numerous prescription medications. So I was always open to alternatives, thinking there's definitely a better way than taking drugs. And, you know, they're fine for an acute situation, but not for a chronic long-term thing. So when Jacque talked to me a little bit about thought field therapy, and I experienced it myself, I was on board and took the classes and found it extremely helpful for patients that are dental phobic. And it's been terrific.
I started out seeing Jacque with my son years ago, and he's 8 now, and he's doing great. Jacque and I, our journey started together with the thought field therapy. She brought it to my attention, and we started working with it, and it's just a beautiful modality, a beautiful therapy to incorporate in allowing your body to heal itself, which is how we're made. And my son is a tapper now. He will ask me often, "Mom, can you tap on me?" And he knows that it makes him feel better. And I'm using it at Redlands Community Hospital and with my cardiac rehab patients, and it's just fabulous. Oftentimes they have trauma with their associated with their heart attack or open heart surgery, their surgeries, and We're using that right out the door during the evaluation. They'll be in tears with tissue, and I just ask them if I can use the tapping. It's a non-invasive, and it's just to allow their body to heal, unblock the things that were blocked during the traumatic experience of either learning that they had heart disease or having their heart attack or their surgery. And they just melt with the tapping. They just really open up, and then their cardiac rehab just goes really well. They get a lot of benefits from the rehab by just starting with the tapping first.
Yeah, what were you going to say about that, Ken? How it improves your actual physical therapy treatments with your patients?
Yeah, basically, without going too much patient information, but what it is just like Michelle was explaining, when you can take off of their shoulders a lot of the trauma from either the fall or life, whatever surgery they just went through, strokes, I see a lot of strokes, taking the pressure off of them and taking that negative out of their life, and telling them that that's not their only identity, filling that back in with something good in their life that they can progress, still be useful people. That's all they want. And, thought field therapy allows me to take off that burden that they have, an actual burden, and allows them to free themselves up to become a better person in their own mind.
Yeah.
So,
Do you
and
find
that allows me to be able to function and do my exercises and teach them safety. It's not overloaded with a lot of trauma in the brain. They're actually able to hear and listen and control. So that's great.
Yeah, have you ever seen it using thought field therapy for someone in pain, and it actually helps bring out the pain out of their body?
Right. I currently have a patient that was 10 out of 10 back pain. I went in, did my physical assessment, worked on her back just like I always do, came out of it, that I had no pain, and 2 minutes later she had just 10 out of 10 pain again. Nothing had happened, but what had happened was I took away the physical one, but she still had mountains of trauma from falling down her steps that just went right back and filled in that negative spot. So when I was able to actually use TFT to go back in there and pull that trauma from the fall out, now I had a patient with 0 out of 10 pain. But it took me having both of those tools to get there. If I had only had the one, I would have left scratching my head. They probably would have done surgery and still would have had pain and a poor outcome. So I thank you gals enough. Can't thank you enough for allowing me to have that in my tool bag, that I'm able to quickly find that and use it, for a patient outcome.
And I think too, Michelle, we could thank Redlands Community Hospital for even letting us teach there and endorsing the certified people who've had the training use it at the hospital.
Yes, it's wonderful. I had a patient as well, had bypass surgery and came through rehab. 2 years later, he learned that he was still having pain in his sternum. He learned that his sternum did not heal correctly, had to go back in for another surgery. Came to me a second time 2 years later and still has this knot up here at the top of his sternum, has pain, and had a CT scan. Everything's negative. The surgeon said, hey, you're healing. It's just going to take time. We went in and treated the trauma of lots of heart history, went in and tapped over the site, had him use rescue remedy twice a day over this. He's been pain-free for 3 months now.
Wow.
First time in 3 or 4 years.
Wow, terrific. Yeah. And Sherry Ziprick, Dr. Ziprick, you brought up dental phobic patients, but we have patients afraid of lab coats, getting shots, claustrophobia, and the MRIs, and anesthesia, fear that they're not going to come out of surgery. Talk about how how helpful it is with your dental patients who don't want to see you because they had a bad experience with a dentist somewhere in the past.
You know, just telling them that I have something that I can do to calm them down, you know, without using drugs, and that we're going to tap some acupuncture points. I find they're more receptive to making that appointment. They're still going to, you know, you still have to get them in there, but provided the patient comes in, I can then go through and tap the different acupuncture points with them. I do it on myself while they're doing it so they can have someone to follow. And I find I have great success with that. They're able to calm down and be calm during treatment. And they like the little extra time that you take with them. They feel like you care. You're doing something that they don't normally get. Normally, they're just supposed to pop a pill before they come in to take care of whatever their apprehension is. And the patient's more cooperative, and so it makes it so much easier to do quality work on them.
You mentioned one time that that if a patient is anxious, they actually feel needles and things more. Their nerves are more sensitive to pain.
Absolutely. Absolutely. That's a big part of pain. I mean, we aren't all the same as individuals, but I have noticed through the years in my practice that patients that come in are super calm, they usually don't feel anything. And if someone comes in that's real apprehensive, they just feel every single thing. And part of it, too, is they're tense and they're more apt to jerk and move, and then they're going to feel things more just because of that.
Yeah. Very good. You know, let's talk about some of the other uses of thought field therapy now that you've been using it for a couple of years. Like today I had someone come into my office yesterday who was on tamoxifen, and it's causing some bone loss and sore gums, and she was swollen. So we used some TFT treatment for the tamoxifen because she has to stay on that for 5 years. And now she has something she could do at home to help her body accept the medication that she has to take. You know, in the energy fields, when we're using acupuncture or tapping the acupuncture points of thought field therapy, the theory is, and it holds true, that if all of our meridians are open, if we're not tensing and resisting the drug, it can move effectively and get the job done without as much of the toxic side effect. I've used this with chemotherapy, with morphine. I've also helped people get off of nicotine and beer and things like that, because we can use it also to help wean yourself off of things afterwards. But talk about some of those kinds of things that come to mind, and, you know, maybe lesser known ways that we use this.
Well, I actually got a patient today who came in with aspiration pneumonia, spent 45 days in the acute setting in the hospital and another 15 days in a rehab facility. So this guy was about as low as you could go before you're 6 foot under. And the problem is they just super loaded him up with antibiotics, so everything started shutting down. His vision started going. Today what I did was similar to what you were saying, is I tapped a bunch of areas with him, did the trauma algorithm with him to try to help release, give him back part of his sight, and it worked. He said his sight, actually, we started reading things on the TV screen that he couldn't do just minutes before. We froze the screen. I didn't tell him anything on there. He couldn't read anything before. We tapped through it twice to get his numbers down. By the time his numbers got down, he looked back at the TV. He's able to make distinguishing letters out. Not able to completely read, but he was getting there. Wow. So that was a big step. They saw. He was very encouraged with that. Even though he didn't know what was going on, we knew as clinicians what was going on, but it took a while for him to understand what TFT was, or thought field therapy, and he's on board, that's for sure.
Michelle, you have like astounding numbers of success in dealing with people with headaches and migraines, don't you?
Yes. Yeah, and just using the pain algorithm typically just takes their headaches away. In fact, today I had a patient that I evaluated for the first time. He had a valve replacement, and we were talking about it, and it was kind of hard for him to think about rating his trauma and the events that he's gone through after his surgery. So I realized that he was having trouble trying to rate the number on a 1 to 10 scale. So I said, well, do you feel it in your body? And he said, yeah, right here. So I said, let's go with that. We went through the trauma algorithm, and by the time we were finished, his tension and pain was completely gone. So that was great to see that. I know sometimes people aren't used to rating their emotions. And so if you can find a physical form that they can relate to, it goes much easier.
One other thing we had talked about before is that thought field therapy is very fast, but like what Sherry Zipprick was saying, the patient can connect with the nurse or doctor or practitioner or therapist, and they feel a different kind of connection, don't they? That they're getting a different part of them accessed and their needs met in addition to the medicine. Well, you want to mention a little bit about that?
Well, you're not just addressing the physical side, what you see there physically, you're addressing them as spirit and their emotional body and everything else. And so you're addressing them as a whole person rather than just one aspect of them.
Yeah, I think that's maybe the next trend that we're starting to see in hospitals like Redlands that are really doing some cutting edge work with this, is that we want to meet the whole person. You know, they say health is not just about being free of pain. You know, health is beyond that. And when we use these techniques, we get them to take the next step. Okay, now the problem's better. You know, what do you want next in your life? How do you bring this fullness back in? And part of it is by, so often we feel just, you know, like we don't have much connection. We're having so much procedure done to us in medicine. There's so much technique and gizmo, you know, electronics and scheduling, and to have somebody just take 2 or 3 minutes and just tap together. There's a very special relationship that's formed that is underrated as part of the real healing process.
Yeah, I often have after doing TFT with several of my patients, they're like, who are you? What are you doing to me? I think I mentioned this before. I had one guy say, I don't know whatever voodoo you do, but keep doing it because you attacked my mind, body, and soul that I couldn't do with even people I pay to do this to. So when you come in and you almost lay me open like a sandwich, pick and choose what's good and bad out of me, throw it out, put me back together, I'm so much better, and send me on my way, I feel like I'm a whole person. So kind of that's what I get out of
That's
dealing with a patient.
Well, I want to thank you all for, I think you've helped people understand what the opportunities are in terms of bringing these techniques like thought field therapy into their particular practice, whether it's hospice care, physical therapy, psychotherapy. You know, I have a nephrologist who uses it with his patients. We've had several drug therapists use it in their drug clinics. There's really no end to where this cannot, you know, interface. And I want to mention that if you go to banishingfear.com, on my website, you'll find the upcoming classes. The Caring for Your Patients is specifically for people in the healthcare field. And it's kind of neat because that group is already got so much going for it, and we're just adding this on. It's a very exciting class that I teach with Michelle. And you'll see that on the, and that is the level 1 thought field therapy. And you'll also see on Banishing Fear that there is what's called the boot camp, and that's the more advanced level 1 and level 2 combined together. It's pretty intense, but you've probably double your tools. There's a lot more that you get to learn with the level 2 added to the level 1. So I encourage anyone who's watched this and learned and been inspired to go on to the website and sign up for one of those classes. One last little comment here that I'd love to hear. We have thought field therapy with online. If you want to learn it online on your own, you can do that. That is an option. I'm a big believer in getting people together to learn something, and talk about what you think is the advantage of doing an actual taking a class with a group of people.
I
I
think
think I'd like to start out with that. When we first taught at the hospital, we had, several people that were skeptical about the therapies. They weren't sure about it. And so bringing it into the hospital, we were able to use and practice the thought field therapy one-on-one in group settings, rotating all over the room and getting to know different people. And one particular nurse had headaches, and she mentioned that, hey, if this takes away my headaches, I'm going to be a firm believer. And sure enough, in her group, her headache went down to a 0. So she was in on the tapping. And it's fun to get into a group setting and be able to practice. It gives you the confidence that I don't think an online class would be able to give. And then you can ask questions, and it's just much more personal.
I might add to that, it really takes it from the theoretical that you get online to putting it in practice and experiencing it, both by treating things on yourself as well as treating someone else. You can't beat it.
Right. For me, it was with Jacque and Michelle instructing us, and the many people that I saw, when I hit the field, I felt comfortable in doing it. My first patient, it wasn't, oh my gosh, I hope I'm doing this right. I know I'm already doing it right because I've already worked with it so much in the classroom.
And I think too, when you're having a class and you've got multiple backgrounds, so many different experiences, and a physical therapist is going to deal with mostly physical problems, cardiac, mostly cardiac, dentistry, mostly dentistry. But when you're in a multidisciplined group of people, you're going to be dealing with far more different kinds of cases than you would have in your own work or family. You have an opportunity to really see how good and how effective you are using it, and things that you normally would not get a chance to use it. Yeah. So I want to encourage everybody to go to Banishing Fear, sign up for a class, the Caring for Your Patients, or the Thought Field Therapy Level 1, Level 2 Boot Camp. You're going to have stories like what we've heard tonight. It's going to be just terrific. It'll change your life. It'll be effective for your patients. And I know we've got a little bit of a hiss right now. I'm not sure what that is, but I trust that my voice is being heard. Maybe it'll be quiet, but we've got some singing in the background with the electronics, and that's just the way it goes. So thank you so much for this evening. I really appreciate you coming and sharing your stories.